Good evening and welcome to this live Q&A session on the policy and practice implications of gender-based violence in the context of migration. This conversation is part of a massive open online course organized by the Global Campus of Human Rights, which is a network of more than 100 universities around the world dedicated to education and research on human rights and democratization. My name is Melchiorre, and I am the academic coordinator of online programs for the Global Campus. I'm here today to welcome and to speak with our guest speakers and talk with them about their experiences, their work in the field, and their suggestions for the future of both migration and gender-based violence. So without any further ado, let me introduce them to you. It is a joy for me to welcome and introduce Renate Frech. Renate is a GBV, gender-based violence and human rights specialist with extensive experience with international and regional organizations, as well as NGOs. And she has worked in a cross-section of humanitarian and human rights field missions. She has previously worked for Office of the High Commissioner for Human Rights and other organizations in Bosnia and Herzegovina, Pakistan, and Kyrgyzstan. And in mid-2014, the UNHCR, that is the UN Refugee Agency, in Amman and Cairo, where she focused on sexual and gender-based violence in post-emergency situations. Then, since October 2014, Renate has been working always with the UN Refugee Agency, but focusing on prevention of and response to sexual and gender-based violence in emergency situations, including in Egypt, Kenya, Tanzania, Uganda, and Italy. So thank you, Renate, for joining us today.
Thank you very much and welcome to everybody. And thank you so much for being able to participate in this online course on this very interesting and important topic. I have to say I was very impressed by reading through and learning about the immense experience the participants of this course have. Just to give a bit of more background, I'm working currently as Senior Protection Officer with UNHCR in a very specific project that is called Safe from the Start, and it is focusing on SGBV prevention and response in emergency situations. So, of course, there's a lot to be discussed during this hour, and I saw the many questions coming in, so I'm really looking forward to this discussion.
Thank you, Renate. And it is an equal joy for me to introduce the second expert in our panel, Laura Pasquero. Laura has been mainly supporting Médecins Sans Frontières fieldwork in sexual violence, although she also works as a consultant for other organizations. Her area of expertise is medical and psychosocial response to and prevention of sexual and gender-based violence in a variety of geographical contexts. For the last 10 years, Laura has worked in Colombia, Kosovo, Morocco, Papua New Guinea, France, and DRC. And since 2015, she has been involved in the response to the EU refugee crisis in Italy and Greece, both on land and at sea. So a warm welcome to you too, Laura.
Thank you. It is also a joy and an honor for me to be here, and I look forward to the discussion also with the people that are following us online. I think one of the greatest added value of such initiatives like a mass online course like this one is really sharing knowledge and experience, so I look forward to doing that with you today.
Thank you, Laura. And indeed, our participants in the course have been really good at doing this, sharing expertise, sharing their own experiences. So today's live discussion is also an additional opportunity for them to pose questions to us and also for us to engage with what they have said previously. Now, as you can see from this brief introduction, we have expertise ranging from a variety of regions, but also from different levels of work. I must say from the beginning that our experts speak in their own capacity. So their views do not necessarily represent the official views of the organizations that they work with. However, undoubtedly, their experience with these organizations has certainly made their own profile, in a sense, and also enriched their own experiences. So we will also have the opportunity to talk from different perspectives, from the work of international intergovernmental organizations such as the UN, but also the work of non-governmental actors. And we will cover protection, but also response and prevention. So before going into the questions, I think I wanted to say a couple of words about the structure and the content, the substance of this conversation. First of all, I wanted to thank all the participants. As I said, the participants in the MOOC are very active, and they have already submitted in advance a number of questions for this small panel here. So I want to thank them all. So I know that some of them are not able to attend this live because of time difference, but this session is being recorded, so I hope that they will access it later and find some answers to their queries. Secondly, for those of you who are watching us right now, there is a space on the platform that we are using for the MOOC to submit your questions or comments to what we are saying now in this conversation. So feel free to do that, and we will do our best towards the end of our session to include also a couple of such questions. And last but not least, I wanted to reassure you all that even if we are not able to take all the questions that have reached us today, right now, we will have a written follow-up in the coming days, and we will publish it and post it again as usual in our platform. So let's start with our questions. Let's go to the substance of this meeting, and we will give priority to the questions that are more practice-oriented, the questions that refer more precisely to policies and practice implications, which is exactly the topic of this talk. So I think I will start with Renate here. One fact that particularly struck us during the course is that, I'm quoting here one of our lecturers, is that gender-based violence occurs in the context of migration because it is tolerated in normal life. So this speaks a lot to the fact of normalization of gender-based violence, and also about the root causes of gender-based violence. That might also be root causes of why people flee from their countries sometimes. So I wanted to put forward to you Jean-Marie's question about what is, in your experience, useful, in a sense, to further uncover the causes and understand better or address the causes that push millions of people outside their own countries.
Thank you. Yeah, I think it's a very important and a very correct statement, or reality rather. It's like a vicious circle that many women and girls, but also men and boys, come from a country of origin and a context where you have a high level of violence, including SGBV. They experience and are exposed to that violence during their journey, and also in the country of asylum very often. When we're talking about what are the causes or the root causes, I think it's important the root causes are generally going back to power inequality and discrimination, but what are the contributing factors? And the contributing factors are very often country specific. I think a very helpful model is when you look at the ecological model, because this is very helpful to divide between what are the individual, the relationship, the community, and the social consequences and root causes. And so you really look also into contributing factors, which of course, as soon as there is poverty, injustice, discrimination, has a direct impact. And I think when we discuss this, when looking into causes contributing to violence, I think we have to look also into new factors. So for example, climate change. For example, what we experience at this moment in vast regions in the south, the famine. We have cases where, for example, families reverted to early marriage because they thought that this might be a protecting measures. But of course, it puts immediately girls being exposed to SGBV. So I think it's very important to look into the country of origin to understand what is the approach to violence and how prevalent is violence. And unfortunately, it is correct that many, many women are trapped in a way in a circle of violence, and that's why it is so important that in the country of asylum you have an effective SGBV prevention and response mechanism established.
Thank you, Renate. Very important points, and I want to underline this idea that you just mentioned about being trapped. I remember during some of the discussions in the course, one of our participants underlined also that sometimes migration itself can be a part of the healing process of somebody who tries to escape from that trap, in a sense, and tries to, as I quote her, forgetting or trying to forget while being in a completely different environment. Now, people might flee from situations of being trapped in violence, but then throughout the migration process, they might still face further violence. So again, this becomes even a further burden for them. So I want to turn now the question to Laura. I'm thinking in particular about cases of sexual abuse or sexual exploitation. Can you share some examples of how victims cope with these situations, sort of like examples of survivors' coping strategies?
Yeah, no, it's a very nice question. In fact, coping strategies and resilience are really person dependent. We're all different, so we all react differently in the face of traumatic events or hardship, and depending on our personal strengths, our profile, our history, our resources, both internal and also resources that surround us. And so it's difficult to generalize. What I would say, though, is that my work is bringing me constantly in touch with victims of gender-based violence that are extremely strong, with an extreme strength and resilience. And some of the stories that we hear in the many contexts where we work are heroic stories of survival. And I think there is tremendous agency and self-empowerment and courage in those people that decide to leave because of GBV, or also because of GBV reasons. For me, it's more even than a healing process. Before being a healing process, is really a life-saving process sometimes. It's a life-saving decision. So we have to acknowledge this agency, not only because there is this myth that still is sometimes present, that victims are vulnerable. Saying that is just saying one part of the story, because they're also extremely strong and resilient, but also because if you think of one of the most common impact of sexual and gender-based violence is the lack of agency, and is the lack of self-empowerment. And so it's something I wanted just to say up front. But going back to the question of coping strategies, what I've seen in the context of migration, particularly those people that do have a strong migration project, if I can say, I think hanging on to that can be a coping strategy in itself. When we hear people on the boat where we work, on any deadly border, because in fact borders are becoming the most deadly places on earth, we hear people that regardless of the hardship and the challenges facing, they believe in the coming of a better future, a better life. In fact, this is the reason why they are leaving. Considering, for example, a survivor that flees for gender-based violence reasons, the will to find a safe space where just to exist, or to find a space with different gender normativity, it is in fact a tremendous motivating factor that will keep the person going forward, wanting to find a safe life for themselves and for their children, or even contributing to the well-being of the family back home. Some, including a lot of children, are tasked with this mission, and they try to accomplish. I can just think of some stories and some people that we have assisted when we were working in Morocco, at the time where Morocco was still one of the main transit areas on the way to Europe for sub-Saharan migrants. There we were assisting them mainly in the forest surrounding Melilla, the Melilla fence, and Melilla is a Spanish enclave, so it's a European Union territory, and people were are still trying to jump the fence, and you would meet people living absolutely on nothing inside the forest, hiding from the police that was chasing them and trying to arrest them, and they would be there for 2 or 3 years, and still they were trying to keep that dream going and still believing that one day they will make it. I think there is extreme determination that we can witness there. Something else that can be a coping mechanism is surely the social environment that a person is within. So same country, community or family, although sometimes these same people can be maybe victimizing or stigmatizing because they have the same entrenched sort of gender normativity. They might not know how to react to an incidence of sexual violence, for example. And then unfortunately there are also negative coping mechanisms, so substance abuse, for example, or self-harm or risk behaviors. And I think also something that concerns more, because you've mentioned sexual exploitation, a lot of victims of trafficking, the compliance with the traffickers is in fact a survival strategy that we also have to acknowledge and respect to a certain extent, in terms of not projecting our judgment on that, having solidarity with other exploited women, or also hanging on to even maybe sometimes a slight power and control on their own resources. A trend that is increasingly appearing is traffic victims that are also involved in the trafficking business itself, so that give them some control that they might have never had in their life. So what as practitioners we should really ask ourselves is how can we as service providers, as NGOs, as activists can provide in terms of supporting positive coping mechanism and supporting the resilience of our survivors and patients.
Thank you, Laura. You have already mentioned a couple of situations or examples that you have witnessed in your work, and I think what I'm going to ask this now is for both of you. I agree that there is a lot of agency that sometimes goes a bit under the surface, in a sense that is not acknowledged enough in a way. And we have seen that also this is something that we have noticed throughout the course, that gender-based violence in the context of migration disproportionately affects women and girls, but inevitably all human beings are involved, whether they are moving within their own country or crossing borders. They may be women and men, boys and girls, people with or without disabilities, rich and poor, old and young, everybody might be affected. So I wanted to pose to you both 2 questions by Godfrey and Salome. What can be done to better protect women and girls from gender-based violence in migration? And if you can share, both of you, examples of work and actions taken by MSF and the UN on the ground. Thank you.
Okay, thank you. Well, I think first I have to say it depends a lot what is the context in which we are working, because it makes a lot of difference if, for example, how I worked in Kenya, in Tanzania, in a camp settlement, in Uganda, where you have settlements but the refugees or asylum seekers are allowed to move, or you're working in a non-camp environment. For example, in Cairo, where I was working in the context of the Syrian refugee crisis, and there it's a very different strategy you have to apply to. Concrete examples, I think first of all and most important, you have to know what are the risk factors. Without knowing what the risk factors are, you might think you address the issue and in fact you do not. And this is already starting to work with the community. It's really to go out to work with the women, with the girls, with the youth, but also with the men and boys. That's very important, to sit down and discuss security issues. and often we do it with a map. We go together with them and say, like, show us where are the areas you do not feel secure, show us the areas where you would need a specific protection. So this is about trying to make ways or movements more safe and more secure, if possible, of course, with increased lighting, but also through other measures. Then maybe it comes with this is also mainstreaming. I think we might talk about this throughout whole the session, because mainstreaming is one of the key issues. It's just not enough to have certain persons who are considered as being the SGBV focal point or the experts, and everybody else points the fingers, you are the one responsible. It goes throughout. You have to look into safe accommodation, into safe access to wash, that is hygiene, toilets, shower facilities. You have to have safe access to food, to non-food items. You have to plan in a way that everybody is safe by accessing those services. What is also important, and what goes with it, everybody is different. We are talking about individuals. So most important is to identify specific needs. There is a difference if a woman is traveling together with the family, if the woman is traveling alone and might be pregnant. It's a difference if the woman is elderly. But we also have to think about persons with disabilities, mental disabilities, physical disabilities. We have to think about persons belonging to LGBTI, and we have to think about men and boys, because they are also very exposed to violence, and often enough also to sexual violence. Talking about other protection measures is really to do all this and to do together, for example, safety audits, but not only once in the beginning, but on a regular basis, because situations are changing, the migration flow is changing, the population is changing. So to really adapt constantly to the new situation, and we are always saying, in every response is the seed of the prevention. And in every prevention, there's also the mitigation. But for doing the right actions, we have to understand what are the risk factors, what are the causes, and also like what are the causes in the sense of where are the people coming from, what we discussed just before. It is very important to understand what is the social and cultural context and understanding of the population we are working with.
Thank you, Renate. I don't know if you want to add something, Laura.
Yes, if I think of MSF work, for us, protection starts from the beginning of our engagement with the survivor that comes and knocking at our clinic. So offering a safe space to disclose experience of sexual and gender-based violence is a first act of protection we do. It has to be, say, a safe space to discuss and to receive care. And actually, it's not just a responsibility we have towards our population, but also it's a precondition for having people accessing physically our clinics and hospitals. The same goes with safe referrals. We, as a medical humanitarian organization, we provide medical and psychosocial support, but then there are needs, as we know, very complex that an SGBV survivor might have, and so we need to link actively with available actors if we are in such a position to have a networking of a network around us. And safe referrals, for me, it's being sure where I'm supporting the referral of the person to, and it goes with, of course, informed consent that we have to obtain from the person before referring her or him. But also what we do is to try and, like Renate said, to lessen the exposure, or to mitigate and to prevent the exposure to further harm. And just like you said, in camps, everywhere where we are and we receive survivors, we try and understand if they have a safe space to go back to and sleep. And this can happen in a displacement setting, it can happen in a conflict zone. And we do, in that sense, put the survivor at the center of the support and of the decision, because in fact most of the time the person knows better, and so if they don't feel safe, they will hopefully be free to tell us, and we'll try to support some safe options, safe houses like Renate mentioned. This is the case, for example, of our work in in Greece. There are some safe houses, although there are often a problem of space available. We did that in Morocco by referring to the IOM safe shelter for victims of trafficking. When we're talking about victims of trafficking, safety and safe referrals are key, because if you're not providing protection, you're automatically putting the person at risk of trafficking or re-trafficking. So it's of course a key concern. And sometimes, unfortunately, when we do not have these safe spaces, we might not have a better option than keeping the person in our hospital facilities for the night until a safe option is found. When we're talking about minors and children in particular of early age, it's quite a concern. If we're thinking of children, for example, that come to our clinic with an accompanying person, we try to understand what is the relation between the minor and the person, because sometimes we experience that the person that brings the child to the clinic might be the very perpetrator or associated to the perpetrating party, and the fact that it's a caregiver doesn't necessarily mean it has the willingness and the capacity to provide care and act in the best interest of the child. So we really try to dig that situation, and of course acting also with the child, having his or her say in whatever decision we might take with him. Something that is quite interesting also, and this doesn't link to MSF work. I was actually in Nigeria 2 months ago with COPI. And in many other countries, we do have a community-based protection sort of mechanism and approach, because, for example, in IDP communities in the northeast of Nigeria that is experiencing, as we know, a critical crisis since some years now because of the Boko Haram insurgency particularly, but we have IDP communities that are being welcomed by local communities, and we think also that these local actors are the best placed to prevent and to a certain extent provide a protective environment even for the most vulnerable, like unaccompanied and separated children. And so what we do is a community work that tries to strengthen again the protective mechanism. We build their community child protection committees and train them and build capacity that also can be a bit more long-lasting and sustainable.
Thank you very much, Laura. I think this also answered the question by Valeria that was asking precisely what mechanisms are in place, if any, if you could give some examples, and you have given a number of them, to better support victims of gender-based violence. I wanted to turn now, always for you, Laura, to another aspect, and this time the question comes from Salome and relates to the harmful approaches in the country of destination. Some approaches that might increase the harm. You also mentioned this idea of trying not to harm more the victims or survivors. So maybe you have some examples of specific policies or practices in certain states that exacerbate the risk for women, especially in case of, for example, she mentions undocumented migrants.
Let me start with something quite basic but very key here, and I think the lack of safe and legal routes for people seeking protection, which includes, of course, many people that have experienced sexual-based violence, sexual and gender-based violence, is key, because if European policies are not letting people access safety and care on a legal basis, they are automatically putting people in danger. We are experiencing to a daily raising death toll in the central Mediterranean Sea, that is in the heart or at the doorstep of Europe. This is something that keeps being shocking, and the rate of people that die at sea, and this includes a tremendous amount of vulnerable people that have endured disturbing exposure and levels of torture and violence in Libya and along the migration route. Well, these tolls are comparable to what we experience in war zones, and this is of course unacceptable. So something that needs to change, and as soon as possible, is something that might prevent something that is absolutely preventable nowadays and that we witness every day. But if I think of other policies that could be harmful, I am thinking to all those situations where governmental actors are actually pushing back migrants to to non-safe ports, and this also is happening under everybody's eyes, and sending people that are in need of protection and in need of support and basic needs to a port that is unsafe is of course exposing them again to unbearable levels of violence. I'm also thinking of another context. Again, Morocco, when we were there, we would be called in the middle of the night by people, including children and women and pregnant women and victims of trafficking. They were sent, they were victims of raids by the police in different areas of the eastern region, and then sent back into the no man's land desertic area between Morocco and Algeria. And of course that puts them at heightened risk again of attack by criminals, smugglers, traffickers. What we could also consider as a harmful approach is all that lack of provision of systematic and sufficient protective environment and safe houses and safe places. And I'm thinking of, for example, Italy and Greece. And although there are some structures that are available and there are some organizations that work very well, these places are just not sufficient for the number of people that are in need of safe spaces. And again, not providing safe places means automatically to expose people to risk of violence and trafficking and re-trafficking. And this is particularly concerning in many countries for children. There are not enough safe houses for children, and there is a direct correlation between this and the alarming number of missing children that everybody is discussing and is concerned about. But let's try to put these things in, of course, in relation. Again, I would come back to something more medical, going back to MSF work, not providing free and confidential care, medical and psychosocial, for victims of sexual and gender-based violence means automatically exposing them to harmful consequences, both on a physical level and on a mental health level. And I have to say that we have to be aware that the package of care that is the minimum of clinical management of rape, for example, is life-saving and can be life-saving because it allows to prevent within a certain window in sexually transmitted infection, among which HIV. So it's really absolutely fundamental that we try to provide these basic services.
Thank you, Laura. I wanted to turn now again maybe to Renate on a question about once these people start experiencing this type of violence, there is an issue also with reporting the violence. To whom, in what ways, and sometimes we have discussed this throughout the MOOC, there is a certain reluctance to report for different reasons. This might be due to a fear of reprisal from the perpetrator, fear of being deported from the country that has welcomed them somehow, and other reasons. So I wonder if you can say something about the processes that you have witnessed in your work about reporting, how the situation looks like from the point of view of your experience, and maybe also something about access to justice, because I see this also as part of the process of being able to access redress mechanisms and have justice achieved. Thank you.
Well, I think it's a very, it sounds like, but it's a very comprehensive question, and a lot, I think what Laura mentioned also is part of the response to that. Reporting is a global problem. We have chronic underreporting everywhere. And I think it's quite easy to understand because the question is just to ask, would we report? It's really being a survivor of an incident of sexual violence or gender-based violence is something which is immediately combined with shame, with fear of retaliation, with stigmatization. So I think I very often say, like, we have to work parallel. We have on the one side to ensure that survivors feel more confident in reporting, but we have also to provide, independent if there are reports or not, we have to put the services in place. And that's why I say, like, it all goes together. because we have to have first the services in place, and we are all quite clear working in this field. We know SGBV is happening. We don't need to wait for the reports. And the problem is also if we don't have good services, good service means also confidential, survivor-centered, private, non-discriminatory. And I'm going there a step further. I always say it has to be non-discriminatory and equal. And why equal? Because equal is more than only non-discriminatory. They have to be adequate, appropriate, accessible. And when we are talking there about different survivors, also survivors have specific needs. It's different if we're talking about female women survivors, children survivors, LGBTI disabled person survivor, male survivors. So everybody has to have this approach, most important, with respect, confidential and private. And it's always amazing how when you're working in a community, how this information goes around. As soon as you have survivors that felt they could report in safety and they did have access to the medical service, the health services, also more survivors felt comfortable in reporting. That's the first, but I think it's an illusion. We will never solve the issue of reporting. It will always remain underreported. Coming to the access of justice, I think when we're talking about a multi-sectoral response, and this is important, then the key pillars of a multi-sectoral response are health, psychosocial service, legal and access to justice, safety and security. I always add the fifth pillar, and this is access to livelihood, because if we're looking into empowerment and then future prevention, this is also key. And in general, we are talking ideally about a case management that is based on a survivor-centered approach. That means like that together with the individual, the survivor, and the needs of the survivor, there's a discussion what would be the services the survivor needs. And one of those is also legal advice and how to access justice. However, there is another problem that many survivors have no confidence in or are afraid of reporting to the police or the justice because they might come from an experience in having been exposed to violence and sexual violence perpetrated by police, by authorities. Now we are taking the interviews and the statements of arrivals coming to Italy. Many stated it all started with being stripped and raped by authorities in Sudan, then continued being raped by the smugglers, then being put in Libya in detention and being raped there by many different persons. So their sense of seeking justice is combined with a lot of fear, with no confidence, and with unknown perpetrators. And then also with the issue of very often we are also in an environment where the system, the administration of justice is not very effective. So for example, if we're talking about countries like Kenya, Tanzania, Uganda, or also Egypt, it's very difficult, and it would be also difficult for national survivors to see justice and to see really a prosecution of an SGBV case. And then though in all this is also one problem, and this is a traditional justice mechanism, because very often survivors turn to traditional mechanisms which are not always survivor friendly. They are not really rights-based. So justice is a very big issue. It's a key component, but it's a very problematic one. And just very shortly to touch upon the asylum procedure, I think what we see there is a gap between what would be there, especially in Europe, because you have Council of Europe resolutions which are very clear on the gender-sensitive asylum procedures and what we see in practice. So it's very clear persecution grounds, SGBV are persecution grounds. There's a specific reference to FGM, to trafficking, to rape, to other forms of sexual violence. They are very clear in stating SGBV needs to be mainstreamed on all grounds. And they are also very clear how a gender-sensitive asylum procedure should look like. It has to go with a lot of training. It has to go with gender sensitivity. It has to go with prioritization of survivors. And when talking about interviews, of course, no survivor will open up if on the other side you have a male person who reminds you maybe on the perpetrator, where you cannot speak in your language you do not understand, and you are intimidated. So you need to have the choice to have female persons sitting. You have to have a cultural mediator, which is more than a sole interpreter. And you have the commissions being trained in asking empathetic and the right questions, and to understand indicators through body language, through the history of the migration movement, to take all this into account. And I think what I have seen also in Italy, you have some very good examples of a very gender-sensitive asylum procedure. Unfortunately, you have also the other side.
Thank you. Thank you, Renate. If I can follow up also with another aspect that is key, that is very important, but again very problematic, and that is the lack of data collection and analysis. We have seen at the beginning of the course that the scope and magnitude of gender-based violence in the context of migration are greater than we know, and this is due to maybe lack of reporting, as we said before, but also lack of data collection and analysis. Do you know of systems that are in place, that are effective, and that are moving to a more effective solution to this problem?
Absolutely, but I would like to just say one sentence, just to show the gap between reporting and reality. We are working in Italy with many authorities, with many women arriving, men arriving. At the moment, it's hard to find any person who is not confirming a statement that any number between 98 and 100% of the women and girls have been exposed to sexual and gender-based violence throughout the migration movement, be it in the desert in Libya, and the same amount of men have been exposed to violence. We don't know the degree of sexual violence. Reported cases, I don't even think we come up to 10%. I don't think so. So it is important to work independent from reporting. But they're very important data collection tools. We are working a lot with the so-called GBVMS, that is the Gender-Based Violence Information Management System. It is a data collection system. It has been established for a key primary reason, that is standardization of data collection, but also standardization of the types of SGBV that are used, because otherwise it's everybody's referring to different categorization of the types of SGBV, and also to a safe, ethical data collection and also sharing of data. Those data is important to know also the limitations. The limitations, it's not showing the prevalence of SGBV happening, but it is clearly showing reported cases, and usually reported cases of survivors seeking assistance, seeking services. But it's a very important tool because it allows us to analyze the data, to analyze what type of SGBV cases, what type of perpetrators, where are security risk issues, who are the survivors, and to use this with other partners when you have a coordination mechanism into really programming and framing SGBV response and prevention activities.
Thank you, Renate. Speaking of service provision, and also maybe the question about how biased sometimes we can be in preparing the responses, preparing the service provision, I wanted to ask Laura I have a quote here from one of our participants that says, "Our judgment is based on our frame of reference." And I said in the discussion that I think this is a key point to bear in mind, especially when we talk about education, raising awareness, about changing the mindset of a society. But I think it's relevant also for service provision. So I wanted to ask you if you are familiar with an example in this sense that has been successful.
Mm-hmm. Sure, I like this question because I think it really sheds light on something important, and not just talking about changing societal understanding of certain issues or certain mindsets, which is of course interesting, and I'll say a couple of things about it, but also it invites me as a practitioner to self-reflect critically on myself as an individual, as a professional, but also as service providers sorry, who belong to a certain world, and so we have also a mindset we might project into our provision of service. So I would like here to challenge the one size fits all. That is something that we are sometimes very good in doing, in offering a package that is pre-packaged and ready for use, instead of turning the other way around and listening to the needs and trying to adapt as best as possible to the request. And also it's challenging the framework that is unfortunately quite common, at least from what I've experienced, that is, we know better. And so that can be, again, quite disempowering, especially if this mirrors a certain power dynamic that can be patronizing, and so sort of mirroring some power dynamic that the person might have experienced, and in the experience of violence itself. In this term, I can certainly think of good practices, and it goes back to some of the things we're discussing, because everything is so interconnected. But if we were talking about some barriers and some fear of accessing services for the fear of detention or reporting, I'm thinking of those women, for example, in Italy, but also elsewhere, that are in country that do provide safe care abortion, and abortion is legal, termination of pregnancy. Let's remember that a high number of women that arrive in Italy are pregnant after, as a result of rape, but regardless of the reason, actually these numbers are increasing. If we think of the Nigerian, particularly, group, there are evidence of an increasing number of women arriving, and more and younger and more in condition of pregnancy. But regardless of the reason of the pregnancy, if in a country access to safe abortion is possible, we should facilitate access. And unfortunately, there are some cases, numerous cases of service providers that refuse to provide safe care service to survivors, and adding on top of that discriminatory attitudes or judgmental attitudes towards sexual attitudes, or assuming that everybody is a sex worker just because they are from a certain group. And that is so traumatizing, both I think for the survivor and also for the service provider, or the social support that we represent when we accompany women. So I think to prevent unsafe abortion that are the only cause of maternal death that is entirely preventable, we have to work within the complexity of our services, and really provide a survivor-centered, caring and empowering advocacy service, if I can say. Something else that I want to emphasize here is the cultural competence of our services in general, that is heavily dependent, and thankfully this profession is also evolving and becoming more formally recognized, but is the one of cultural mediators. All our services include a precious presence of wonderfully skilled cultural mediator from a variety of nationalities and cultural backgrounds, and that enable us not only to be able to establish the contact from a linguistic point of view, and we have cultural mediators who work with us that know an incredible amount of languages and dialects from all areas of the world, but they are an actual bridge in terms of cultural understanding, in terms of identifying survivors, and that can be key in case we might be the only option or occasion for survivors to disclose and request medical care and psychosocial support and protection. I'm thinking, for example, the work, again, that we do on board of our ships that work in the Central Mediterranean Sea, bringing people to safety. We are able to identify and provide care to survivors on board, although the situation and the conditions are very, of course, difficult. We're talking a very restrained space, and we have not a lot of time that we spend on board with these people, but the actual human and empathic welcoming on board, and the help of our cultural mediators that of course interact so much more easily and profoundly with our people on board, make that link happening, and there is that trust that is established, and together with other practices like the provision of course of care on board in a safe and confidential space in our clinic, the division of women from men. These a series of measures make that access to care possible.
Thank you, Laura. I mentioned earlier that we have noticed that women and girls suffer disproportionately from sexual and gender-based violence, but throughout the course the issue has been raised also about male survivors. So you have already mentioned a couple of things about this issue, and you, Renate, also talked about LGBTI and Q people. So I wanted to ask both of you if you have witnessed any recent developments in this aspect. I want to let you know the thoughts of one of our most vocal participants, Faustine, who reminds us that the conceptualization and debate of SGBV at the international, regional, national and domestic levels needs to be broadened to refer explicitly to men as well as women. And Faustine argues that the day has come to open up channels of dialogue so that it becomes acknowledged that men and boys can be victims of sexual violence too. So have you seen any significant development in this sense?
Well, I think it's a very important point, and I could not agree more with the statement of the participant. And in fact, I think there is a development. My personal opinion is it is too slow. Again, we are very clear the vast majority affected are women and girls, and this is not changing, but I think it's important, and also coming from a human rights perspective, it's really important to always look where are the also more also vulnerable, or are we covering all persons affected by this? And it is well known that men are also exposed to sexual violence. We have seen this in Bosnia. There are outrageous examples of sexual torture against men. I have personally interviewed sexual survivors from South Sudan. We had cases of sexual male survivors in Egypt, in Cairo. It's just, I think there is a slow development, and it comes a bit also from the side of sexual conflict-related sexual violence, sexual torture in detention. But we're trying to look into now and starting a pilot project also in Italy, starting really to which extent are men also exposed to sexual violence? Because what we see is we often discuss sexual violence in the country of origin or during the migration movement, but we are not looking, okay, what is the level of exposure to SGBV in the country of asylum or in Europe, let's say it. And we do see especially sexual exploitation. We know it from adolescent boys from Egypt, adolescent boys from Afghanistan. We know in the meantime that certain cultures have a high level of rape of male adolescent, and it's just very, very difficult for them to disclose this because the level of stigmatization and fear is even higher. And it is, for me, it was interesting when I learned this and really started to look into this systematically, that in cultures where there's a persecution of homosexuality, it's very normal to rape young boys. But to give an example, I was working closely with MSF in Cairo, and there we were touched also upon this issue. And this one doctor told me she interviewed a victim of survivor of torture over 30 times, and it was really like therapeutic sessions. And between the 32nd or the 35th time, the man, it was revealed, in fact, that he was also a survivor of sexual violence. Our services at this moment are very focused to provide services to female survivors. And very often when I address this issue, and I have done it wherever I go, so if I address it, for example, it was in Kenya, in Kakuma, in the refugee camp, then the response very often from service providers is, but they can enter, we have the same services, there's no discrimination, not considering sufficiently about the equal approach, the adequacy and the appropriateness. Because if male survivors would enter into any service where you have female survivors, they would be seen as the perpetrators. So it would be very difficult for them to really go and seek the service. And I think we are by far not there to start understanding what are the needs of male survivors, because they are different. I remember I had the interview with one survivor who was mentioned before. He was raped on the flight from South Sudan. He was at the point of committing suicide when he arrived, because his only words were he lost his manhood, he lost his a part of all the health consequences. He thought he lost all the role he had within his family, and it was a very difficult and painful process to reach the point for him to be able to look straight again. It was for him not possible. And so it is, I think it is very important, and I think as human rights and as humanitarian professionals, we always have to work through a human rights and a rights lens, and a rights lens is always looking at everybody. So if we're talking about SGBV, and I think all new definitions of SGBV, certainly when looking into UNHCR, when into looking at the humanitarian partners and others, it is always survivors of sexual and gender-based violence, women, girls, men, boys. And in fact, the most interesting part is there is a review of the definition, because the question is this enough? And it's not enough, because we have to refer to LGBTI. So it's a lot of very interesting dynamics, but a lot more has to be done, also in practice. I think in both, in policy development and in practice.
Thank you, Renate. Laura, would you like to add your thoughts?
I completely agree with what have been said, and I think for For a long time, the global discourse on GBV is really focused on the plight of women and girls, and whenever a man was mentioned, was never in the role of survivors, but rather as the perpetrator or somebody that we need to involve in prevention efforts. Where, as it was said, there is an increasing body of evidence that men and boys are also, of course, victims of sexual and gender-based violence, and sometimes are specifically targeted, particularly in context of conflict and displacement. There is, however, scarce research on the issue, although it exists, but it's not systematic, and we lack systematic data and observation. And I want to take this occasion to mention a project I've recently become involved with. It's an independent international research fact-finding effort that wants to look exactly at those contexts, a series of contexts around the world of conflict and displacement, looking at pattern and scale of sexual violence against men and boys, but also at the humanitarian gap in responding with adequate or gender-inclusive or adequate response for the whole set of needs that men and boys have. The project is called All Survivors. You can find it online, allsurvivorsproject.org. You can follow it on Twitter and Facebook as well. And the first report has already been published. It's on Bosnia and Sri Lanka, actually, because you mentioned Bosnia. From a more practical point of view, actually, if we reflect on some gender ratio of, if there are some statistics that speak of a high amount of male children that are, for example, received in certain migration contexts, including in Europe, and sometimes the ratio is 90% male children, minors, and 10% women, girls, and then we speak a lot of sexual violence against children. Now, if we put these two data in relation, we might guess that actually a higher number of also men, boys, as Renate mentioned, is also suffering from sexual violence. MSF is currently really putting a lot of effort into putting down the barriers to disclosure and to access to medical and psychosocial care for male victims. Everywhere where we work in the world, including in Europe and in migration context. Practically what we're doing, for example, is to try and avoid to provide sexual violence care only in women-friendly places, like in maternities, for example, which would, of course, sort of discourage men to seek care in something that is not, in a place that is not men-friendly. Another element that we've seen useful is to try and have available both male and female medical staff, because, and to offer the choice. The actual request of a specific gender by a man might be in itself a silent sign that the man has suffered from sexual violence. This is what our experience shows. We're also training our staff in recognizing both clinical and silent signs of sexual violence in men and boys, and how to also engage and respond to some fears, like Renate said, the fear of losing one's masculinity, or they start to sometimes doubt their own gender and sexual orientation. So having a reassuring attitude and know how to, and being ready to face this type of situation, and reinforcing medical confidentiality, of course, can really be very, very helpful. The same goes with the LGBTQI group, of course, having an LGBTQI-friendly clinic that reassures the person. This is a group that is often re-victimized also in the countries of transit, of arrivals, sometimes by the very LGBTI community, in fact. This is something that is emerging from a very interesting research called Epsilon. It's a report funded, I think, from the European Union that brings to surface both the challenges and also the best practices in different countries in Europe on how to best provide access to support to LGBTI migrants. I think I recommend that.
Thank you both. I would like to continue for hours, and I still have some questions pending here that have been posed to our panel, but I'm afraid our time is up. As I said before, we will try to provide some written feedback, written answers on questions related to community response, the issue of returnees, and also the big issue of accountability. So we will try to do, to the extent possible, this written follow-up. For the time being, what we have said today and what we have witnessed and read throughout the course is that the situation is really serious and grave, and it makes for a difficult learning process. But I think that the fact that we are talking about it, the fact that we are giving opportunities to people to connect and reflect about their own experiences is already a step in the right direction, and I use right in every possible sense of the word. So I want also to finish a bit on a more positive note and encourage us all really to focus more on our common humanity, more than on the differences that perpetuate violence. One of our participants underlined this and said, why is it easier for us to focus on the differences and continue violence rather than focus on the fact that we are all the same human beings with the same rights and the same freedoms and the same dignity? So with this positive note and positive encouragement for us all, I want to thank the two experts on our panel. Thank you, Renate. Thank you, Laura, for your insightful inputs. I want to thank the coordinating team behind the scene for helping this process and making this live session possible. And I want to thank all the viewers and the participants which keep on giving their encouraging commitment and helping us with bringing forward this message. Thank you all. Bye-bye.